Hey everyone, this is Erica, and I am going to talk today about membrane stripping or sweeping membranes. So when you're pregnant, this is a procedure that many doctors will offer towards the end of your pregnancy, sometimes as early as 37 or 38 weeks, which is a little ridiculous. A lot of times it's 39 or 40 weeks that they offer it, and definitely 41 or 42 weeks. So just to have an understanding of this, normal pregnancy length is between 38 and 42 weeks. That's a whole month of leeway. So if you're getting to 38 weeks and you're just like, I want to be done, you still may have a whole month to go. One of my sisters actually went 41 and 42 weeks with almost every one of her pregnancies. Some babies just need to cook longer, and there's nothing wrong with that. And yet doctors seem to be, They seem to want to push women to have their babies sooner than their baby is ready to come, and they want to tell women that their bodies aren't working, which is incorrect 99% of the time. Your baby's just not ready to come. So membrane stripping. So when I was pregnant with my first, I got to for almost 40 weeks. It was like the week before I was 40 weeks, and the doctor's like, we're gonna just strip your membranes and see if that gets things going. And I didn't know what that meant exactly. I mean, the doctor explained that stripping membranes was going into the cervix and sweeping in between the cervix and the amniotic sac and getting all the membranes separated from the uterus, which would then jumpstart labor. It would release different hormones to get things going. And I was excited to see my baby. I wanted my baby to come, right? I was excited, and I just thought, oh, okay. I had no idea there were risks with that. I had no idea really what that entailed. So I went in, and it was just a few days before 40 weeks for me. I went in to get my membrane stripped, and the doctor did it, and it hurt. So this is not a procedure that is just, oh, whatever, this is something that hurts, okay? And it hurts pretty much all women that this happens to. And the doctor's like, I'll do it gently. Right. It hurts, all right? You're all swollen down there, and the baby's pressing down there, and it is inflamed sometimes. Just you're at the end of your pregnancy, and it's all very, very sensitive. And so, yes, stripping your membranes hurts. And then there's also risk of infection. So the doctor can actually introduce bacteria into your vagina during that procedure and cause an infection. Also, if you test positive for GBS, group B strep, this is a procedure that you should not have done. That increases the risk quite a bit of infection. Many times there's vaginal bleeding. When I had my membrane stripped, I did have bleeding that accompanied it. Also, it can cause cramping, like major menstrual cramps, and that happened to me as well. It was extremely, extremely painful for the next day or so. It was very, very painful in that specific area where the membranes had been stripped, and then I actually did start into labor. But the doctor can also accidentally rupture the membrane sac. The amniotic fluid can start to come out by an accident. When they're sweeping the membranes, they can accidentally rupture or poke through the sac, which then you've got to have your baby once that is leaking. So yes, doing that can increase some of the hormones going on. Yes, it can jumpstart labor, but the jury's still out on this. Many times women have this done and nothing happens. So it doesn't necessarily mean that you're going to go into labor when you have your membrane stripped. Many women say it wasn't worth it. Some say, I went into labor a few days later, but when you're that far along, it could have happened anyway. So the evidence that is out there is really not clinically significant that this is a worthwhile thing to do to jumpstart labor, but it is something that is very common that doctors offer as part of their practices to strip the membranes. So there are a few things that you can do if you want to jumpstart labor. And acupressure is one of those things, and I would not recommend this at all before 40 weeks. Just don't. There is no reason that you should be trying to get your baby out before your due date. There's just no reason. Your baby needs to be in there as long as possible. And if you're worried about having a big baby or whatever, a lot of times predictions of a big baby are inaccurate. So just be careful of that. If your baby's still cooking, just let your baby still cook, all right? But there are a few things that you can do. Acupressure. There are acupressure points in your shoulders. There are acupressure points in your hands and in your ankles, in your feet, that can be used to stimulate the uterus to produce oxytocin and the other hormones that kind of kickstart labor. Or if you're already in labor and your labor starts to slow down, these acupressure points can also help to get your labor going again. But if your labor has slowed down, that may be your body just telling you it's time to take a rest. And if you're in the hospital, a lot of times they will rush you. If your labor starts to slow down, they will tell you that it needs to speed up. We need to get this going. That is not for your benefit. That is for their benefit. So you need to be very clear with them that you are going to let your body do what it naturally is going to do. Also acupuncture. So a lot of people like acupuncture for many different reasons, and acupuncture can be used as well to help bring on labor or to help speed up a labor that has slowed down. Also orgasm and nipple stimulation. These two things can be used together, and you can do this. Now these things can be used for weeks beforehand and all the way through. So you may not feel like it, but it is one thing that can help things move along very well. So those are some other options that you can use to speed things along with your labor, or to help start it if you've gotten to the end, like 41, 42 weeks, and you're like, let's get going because I don't want a C-section. But so many women are being told by their doctors that they shouldn't trust their bodies. Trust your body. Your body knows what it's doing. It is very, very rare for a woman to stay pregnant forever. It just doesn't happen. And yes, once you pass 42 weeks, then there are risks that happen. But before 42 weeks, it's totally normal to have a baby at 42 weeks. So just keep that in mind. And for me, I never did that again. I never asked for that, and I never said yes when they offered stripping of membranes. It was a very uncomfortable procedure. For me, it kick-started a labor that lasted 3 days. My body just wasn't ready to have the baby, but it started things moving, and then I was just in labor, painful labor, for 3 full days before I had my baby, and I was exhausted. And I really felt pushed, and I didn't come away from that experience feeling empowered, partly because of that. And there were other things that happened as well, but it started with stripping of the membranes, which just let your body do what it's going to do. And your body will go into labor on its own. 99% of women's bodies will go into labor on their own if they are allowed to do so. So think about the risks and think about the possible benefits, because this one, like I said, the actual studies out there are not clinically significant that this actually helps things move along for everyone. All right. I hope you learned something, and we will talk to you later.